Hi, welcome to Medicare 101. My name is Larry Hurwitz, and I want to go ahead and talk about some of the changes for 2019 and 2020 that are available to you guys for Medicare plans, for Medicare supplements, when you can enroll, different options available to you. Just like if you're in a live seminar, I want this to be interactive, so please write down or text me or email me your comments, and I'd be happy to answer those for you. Any questions that you have, as a thank you just for being involved, I'd like to send you a water bottle. It has a chamber in the middle to go ahead, add your tea or your fruit to infuse that any way you'd like. But what I'd like to do is go ahead and get through this so we can try to cover as much material as soon as possible. But there have been some changes, and Medicare can be confusing, and I'd like to try to make this as simple as possible for you guys. But right away, let's go ahead into the first slide about what is Medicare. Original Medicare, which is your hospital A, your medical B, your two main roads when you have Medicare, which is your supplement or your Medicare Advantage plan. Also, if you have a supplement, you're going to probably want a prescription drug plan, Medicare and Health Insurance Marketplace. That's possibly for people with Medicare. Generally, it's not going to make sense, but we'll get into that as well. Different options available for folks with limited incomes that could make sense for you. So we want to try to cover as much material as possible and try to give you guys all your options so you're going to take advantage of your health care the best possible way for your specifics, because making wrong choices can really cost you a lot of money. And worst thing I wanted to do is cost you things that could jeopardize your health. Medicare is available to people 65 or older. If you're under 65 with disabilities, you're generally going to have be on disability for 24 months, and your Medicare would kick in the 25th month. Unless you have ALS, there's no waiting period, or ESRD, end-stage renal disease. What agencies are responsible for Medicare? Social Security enrolls most people. CMS is Center for Medicaid Medicare Services. When we get into open enrollments, we'll talk about that, how, for example, if you've collected Social Security for the last 4 years, you'll automatically be enrolled in Medicare. Otherwise, you'll need to proactively enroll. If you reach out to my office, we can help you with the enrollment, walk you through how to get on the Social Security portal, create an account if you don't have one, and to go ahead and enroll yourself. Okay, Part A is your Medicare hospital. What does Part A cover? That covers your hospital, your skilled nursing facility, hospice, blood. Now, please keep in mind your Part A hospital is only the facility. It's not the doctors in the hospital. For example, if you had surgery in the hospital, that would be under your Part B. Part B is all your medical insurance, includes your DME, durable medical equipment, pretty much everything outpatient is your Part B. Your Part D is your prescription drug plan, which you're going to buy a la carte if you have original Medicare and or a supplement. Generally, if you have a Medicare Advantage plan, it will be what's called a Medicare Advantage prescription drug plan, MAPD. So generally, that's going to be all-inclusive, and that's going to include your prescription drugs. But there are Medicare Advantage plans that don't include prescriptions as well. Let's get into when you first enroll in Medicare. What are your options? As I touched briefly in the introduction, there are two major roads. Original Medicare, where again, we're going to get most likely, unless you want to have deductibles and co-insurance and high potential out-of-pocket costs, if you're going to do that, you're most likely going to want to get a supplement or a Medigap policy. A Medigap is just another word for a supplement, or you're going to want to get a Medicare Advantage plan, which is going to limit your exposure, so you know that you're only going to pay a certain amount of money, then it will cover 100%. And the great thing about Medicare Advantage plans is the fact that they have to cover at least as much as original Medicare. There's nothing that original Medicare would cover that a Medicare Advantage plan would not. And mostly they're going to cover more, and generally they're a lot less money. Here we're on slide 8. Again, we're talking about original Medicare Part A, which is your hospital. B, again, is your medical. If you want drug coverage, D. So again, just remember, A is your hospital, B is your medical, D stands for drugs. And if you have original Medicare, you're going to most likely want a supplement to pay the 20% co-insurance. And by the way, if the doctors do not accept Medicare assignment, they can charge an additional 15% on top of the 20. That's called excess charges. So some Medicare supplements pick up not only the 20%, they pick up those 15% excess charges as well. Okay. let's go on. Medicare Advantage plans are generally Medicare Complete plans. They're all in one. Alternatives to Medicare. It's just another way to get your Medicare. Another word for Medicare Advantage plan is Part C. What's really nice is 2020, throughout the state of California, most Medicare Advantage plans are going to be less money. Now, typically where you live, you might already have a plan that is a zero premium plan, but sometimes that just means that your maximum out of pocket, your MOOP, is less, and or there are some new plans available that actually pay for part of your Medicare Part B premium. So your Part B, because to have a Medicare Advantage plan, you have to be enrolled in Part A and Part B. And some of the new Medicare Advantage plans actually pay for part of your Part B premium. So if you call our office, we can talk to you about those plans as well. Many plans may offer benefits that original Medicare doesn't, like vision, hearing, dental, and more. Those are some of the Medicare Advantage plans. Like a lot of seniors, for example, love silver sneakers, which gives you free gym membership. Some of the plans out there nowadays are offering you guys a quarterly over-the-counter allowance for drugs and other things, whether it be aspirins or all kinds of things. You get a catalog that you get a quarterly allowance for. Also, you can get additional benefits, such as there are plans that have emergency response systems, which is basically the company, not the same company, but other companies with the I fell down and I can't get up, that's free. There are also various plans that even offer you guys Fitbits to track your walking, because they're trying to encourage you to be healthy. Because what does it mean when you guys are healthy? It means less money. It's a win-win situation. It's healthier for you, and it's less money the insurance company has to pay for you, because if you guys are taking care of yourselves, you're doing preventative stuff. So that means hopefully you're going to not be sick, not go to the doctor as much, not have chronic conditions. So it's a win-win situation, right? So it's nice to be able to have all this great preventative stuff. And like I was saying, the fact that these companies are getting more money, a lot of them are being more creative to try to give you guys more, and which again hopefully means that you're healthier. So it's a win-win situation all around. With original Medicare, the biggest advantage is they can go to any doctor that takes Medicare, which is virtually everybody, and you don't need to get a referral to a specialist. So people who have certain doctors that are not part of a Medicare Advantage plan, original Medicare and a supplement could make sense for you guys, and probably is the best solution. On the other hand, Medicare Advantage plans are generally a lot less money. Depending what county you live in, there's some great zero premium Medicare Advantage plans. And some people actually like the fact, especially if you don't have certain doctors, and by the way, there's a good chance your doctor might be part of a Medicare Advantage plan, but what's nice about Medicare Advantage plans, medical groups, is the doctors actually speak to one another. So if you have a primary care doctor and a specialist of some kind, and this doctor and that doctor, what that means is they talk to each other to make sure that there's coordination of your care. Sometimes if you go to your own doctor and a specialist and this doctor and that doctor, they don't communicate. So even though you have that freedom of choice, it's not necessarily the best care. So if you're the kind of person that's a real advocate for their own health and needs to go to certain doctors, original Medicare might make more sense for you, especially if the money's not an issue, whereas a Medicare Advantage plan, on the other hand, could make more sense for a lot of other folks. And again, many doctors are part of the Medicare Advantage plan. So if you call my office, we can check your doctor and see if he or she is part of any of the different Medicare Advantage plans. And then we can help you determine what's the best solution for your specific details based on running your prescriptions and other issues as well. Just like if this was a seminar, please leave any questions or comments below, and either myself or one of my team members will be happy to get back to you, answer your questions. Your health care is important. You need to make sure you're getting the best value and the best possible care for your specific needs. We're still talking about original Medicare and a Medicare Advantage plan. I think I pretty much covered all these things. Original Medicare, you pay a premium for Part B, but you also pay a premium for Part B with the Medicare Advantage plan. There's either way you got to pay for Medicare Part B, but like I said, this year there are some carriers, Medicare Advantage, that actually pay a good portion of your Part B premium. So You have to be enrolled in Part B, but it could be a lot less money, maybe somewhere around half. Original Medicare, unless you have a supplement, there's no limit on how much you pay out of pocket. That 20% goes on forever. So, I mean, you could have a, $500,000 hospital bill, God forbid, and 20%, there's no cap unless you have a supplement, again, which would pay for all that. Whereas if you have an Advantage plan, that's going to cap your maximum out of pocket. So my advice to you is if you don't qualify for Medi-Cal, and so you're not Medi-Medi, if you can't afford a Medicare supplement, I would recommend enrolling in a Medicare Advantage plan to limit your exposure. But, we could have that conversation if you call my office. You can get a supplement coverage like Medigap to help pay the 20% we talked about to dovetail with Medicare to limit your exposure. You cannot have a supplement if you have an Advantage plan. It's either or. It's either a supplement or an Advantage plan. Road 1, Road 2. Original Medicare covers medically necessary services and supplies. Medicare Advantage plan, again, everything that regular Medicare covers, a Medicare Advantage plan does too. And as I was saying, a lot of Medicare Advantage plans covers things above and beyond, like vision, hearing, dental. We talked about the Fitbit. We talked about silver sneakers. We talked about the over-the-counter benefit. There's all kinds of additional benefits above and beyond many of the Medicare Advantage plans cover. A lot of them even cover meals, whether you're coming home from the hospital, 30 days worth of meals. A lot of them include transportation. So again, we'll find out what your needs are, what's important to you. We'll get you the best plan for your needs if that's the direction you want to go. Original Medicare for traveling. Medicare generally doesn't cover outside the U.S., but some of the better supplements do have a foreign travel benefit. Medicare Advantage plans generally don't cover care outside of the U.S. For non-emergency services, but generally for emergency services, they do have a benefit. I know that my father, when he was traveling and he went to the Panama Canal, he needed to get off and go to the hospital, and we got him reimbursed for his plan through his insurance carrier. Okay. How do you get enrolled? I think I mentioned earlier, if you're collecting Social Security, which is generally 4 months before Medicare, you're automatically going to get enrolled. Railroad retirement benefits. Your initial enrollment period, your IEP, is mailed 3 months before you're 65. Remember, I mentioned before, if you're on disability, your 25th month. Include your Medicare card. Your Medicare card, you'll see an image later on, is no longer your Social Security. It's going to be a unique number now, so to prevent identity theft, which is something that they've been talking about for a long time, which they just finally got implemented not too long ago. Okay. Oh, there's the card right there. See, you can see your Medicare number right below John Smith. It's a unique number, and it says Hospital Part A, Medical Part B. If you are not going to use Part B, for example, if you're in your group insurance or through your employer and your employer is paying 100% of your costs, there's really no reason to pay for Part B. I can't tell you how many people I've spoke to that paid for Part B because they thought they had to be in Medicare or they'd be penalized. So they paid for Part B premiums even though that they had employer insurance, and then they paid for, they worked till they were 75. Might have paid thousands of dollars, 5-10 years, when they didn't need to. So if you sign the back of your card, you can refuse your Part B. And again, call my office. We can help you make a determination whether it makes sense for you to accept Part B or not, depending on your employer situation. Might make sense, might not. First thing you need to find out is how much does it cost you out of your paycheck to be on your insurance? Do you have dependents? What would that cost? Can we get you insurance for your dependents? How much would that cost? I am a graduate of the College of Financial Planning, certified financial planning, so I can help you with all that as well. Again, I've been in this business for 30 years, and I'm here to help you, advise you what's the best solution for your specific needs. Most likely you're going to want to be in Part A though, except for some unique circumstances. Even if you're on your group plan through work, most likely it's going to make sense for you to be in Part A. There's a couple of situations, for example, if you have a medical savings plan, you might not be able to contribute if you have Part A, but that would be a unique situation. Okay. You must take action to enroll in Medicare when it's not automatic. And I was mentioning to you guys, if you want to spend some time in the Social Security office, you're welcome to do that. I highly advise that you go ahead and do that online. And again, my office, we can help you do that and coach you through that. Make that easy as possible for you as well. Help you download your beneficiary notice, all that great stuff. If you don't have Medicare, your initial enrollment period, IEP, these are different enrollment periods, your general enrollment period, your special enrollment period. And when I was mentioning, I don't know if you remember a couple slides ago when I was saying you don't need to enroll in Medicare if you have an employer plan and necessarily pay a penalty, that's because if you were to leave your group plan, your employer plan, you are entitled to a special enrollment period. You have 8 months actually once you leave your group plan that you can enroll in Medicare. There's just some additional paperwork that you need to fill out because the last thing you want to do is go into the general enrollment period, and that way you're going to be, we'll get to another slide, that's January to March for July, and then you're going to get a penalty. So the last thing you want to do is a penalty if you don't have to have a penalty. So again, call my office. We can help you through that. We can coach you through that, get you the right paperwork, and so you can talk to HR, Human Resources at your company, and make sure they do what they're supposed to do on their end. Okay, initial enrollment period, 7 months. Initial enrollment period, this is your initial period where you're enrolling in Medicare, which you can start 3 months before you turn 65, the month that you're 65, and 3 months after. Almost all the time, Medicare is going to start if you enroll before you're 65, the month before you're 65, the first day of the month of your birthday month. So if your birthday is, my birthday is May 3rd, so if you enroll, as long as I enroll, February, March, or April, I'm going to be effective May 1st. On the other hand, if my birthday was May 1st, believe it or not, I would be effective the month prior, April 1st. So that's the way that works. Now, I can still enroll 3 months after I turn 65, but if I do enroll, let's say in June and my birthday is in May, I'm going to be delayed 2 to 3 months. So even though I can still enroll, you really want to enroll before your birthday month, at least 1 month before, but I would definitely recommend 2 or 3 months before your birthday month you want to enroll. Call our office, we can help you with that. There'll be no late enrollment penalties. And you can buy a Medigap policy within 6 months from both, without any pre-existing conditions, without any questions, after 6 months. Now remember, a lot of people don't know this. When we get into open enrollment periods, every year, October 15th through December 7th, you can enroll in a new prescription drug plan or a Medicare Advantage plan. But Medicare supplements, unless you do it during your initial enrollment period, unless you have some kind of special enrollment, is not guaranteed issue. I know we talked about some advantages between Medicare supplements and Medicare Advantage plans, but if you are on the fence, keep in mind, you might want to go with the Medicare supplement, because if you don't do that, it's going to be difficult for you to get it later unless you answer health questions. Here's general enrollment, and this is what I was talking about before. General enrollment is between January and March, and it starts July 1st. That's for folks who did not mostly enroll in Medicare during their initial enrollment period. So now they're going to be late, because if I didn't enroll in Medicare when I was supposed to enroll, I can't just all of a sudden enroll at any time. I have to wait for general enrollment, which is between January and March of every year, for a July start date. And I'm going to have to pay a 10% penalty for every year that I did not have it. And that penalty is going to last twice as long as I didn't have it. So if I didn't have it for a year, my 10% penalty is going to last for 2 years. Here's Medicare Advantage open enrollment period. This is something that just started last year, by the way. January to March. So even though, again, open enrollment or annual election is October 15th through December 7th, if I have a Medicare Advantage plan already, I can switch out of my Medicare Advantage plan and go into another Medicare Advantage plan between January and March. So you still have that option available to you. You can also drop Medicare Advantage and return to original Medicare and get a prescription drug plan if you want. Open enrollment period, we talked about the annual election period open enrollment, which is again October 15th through December 7th. And that's what we're having right around the corner. So again, please call me to make sure you're getting the best possible plan for this year. Medicare Special Enrollment Period, SEP, we talked about that before. For example, one SEP would be if you were on your employer plan, you refused Part B, you have 8 months to enroll in original Medicare without a penalty. Again, there's certain paperwork. Call my office. We can help you with that. And if you do that, you have 6 months from your Part B effective date to buy a Medigap policy. You also have a window to go ahead and enroll in a Medicare Advantage plan as well. There's also an SEP for a 5-star Medicare plan. You can do that once a year. Plans are ranked based on their stars. Stars have to do with customer satisfaction and a myriad of other things. The higher stars are generally better. You generally want to have a plan that has at least 4 stars or above. I think as long as they have 4 stars, you're generally in good shape. If they have 4 stars, by the way, they get extra money for Medicare. So what that means with that extra money, the providers get extra money, so generally they're going to be happier if you're in one of the plans that have 4 stars or above when you see your primary care doctor. Now let's talk about some other Medicare special enrollment periods. For example, let's say that I have a Medicare Advantage plan in LA County and I'm going to move to Orange County. That gives me an SEP because my plan is a regional plan. It's not going to be available to me. Even if I have that same carrier might offer a plan in Orange County, and if I go from LA or to Ventura County or whatever, I need to get another plan when I go to that county. So I do have a special enrollment period when I leave one county and go to another county, okay? What are some of the other reasons? For example, I might lose extra help based on my income, might get a big inheritance, I don't know, I'm waiting for that, might win the lottery. Your plan leaves the Medicare program or leaves the service area. So if my plan leaves the service area, I have a guaranteed issue right under a special enrollment period that I can go ahead and enroll in another plan. Check your knowledge. Why is your Medicare initial enrollment period important? A, missed enrollment deadlines could result in penalties. B, it's your first opportunity to enroll in Medicare. C, when you enroll impacts when your coverage begins. Or D, all the above. What do you guys think it is? Yeah, all the above, D. Let's go to the next one. Lesson 2. Original Medicare Part A hospital and Part B medical insurance. Part A is, again, your hospital insurance. Part B is your medical insurance. And that's your coverage and costs, and if you have active employment. So original Medicare, back to that, Part A, your hospital. It covers, again, your inpatient, your semi-private room, inpatient skilled nursing. You need to be in the hospital for 3 days before you could go ahead to an SNS. So for example, my dad needed occupational therapy to help him eat and all that. If he didn't go to the hospital for at least 3 days, he wouldn't have qualified for that. Part A, your blood, your inpatient care, your home health care. What isn't covered? Private duty nursing, private room. Sometimes you can pay an upgrade cost at a hospital if you want for that. Television and phone in your room if there's a separate charge for these items, but generally that's included. Personal care items like razors and slippers and socks. Okay. Let's talk about paying for Medicare Part A. Most folks are going to qualify who have worked for Part A because you guys have paid into Part A your whole life most of the time. That's what payroll taxes are all about. When you wonder why, hey, how come my paycheck is so much less than I thought I was making? Because all those payroll taxes, they're deducting 8% from you and your employer pays 8%. A big portion of that is your Medicare and your Social Security. You've paid into it at least 10 years by working, or if you didn't work, you're married to someone who worked and you could qualify under your spouse. If you didn't enroll when you first became eligible, then there will be a penalty. We talked about that 10% penalty earlier. What you pay in original Medicare. Right now for 2019, it's a $1,364 deductible. Shortly, we should be getting the deductible for 2020. I don't know if it's going to be any more this year. If it does, your Medicare supplement will automatically adjust for that. Your Part B deductible, which is only $185, that's not going to be covered by the supplements going forward. Because again, Plan F is not going to be available for 2020. The most popular plan will be Plan G. You're going to pay $341 per day for days 61 to 90 for each benefit period. It's confusing because a benefit period is for your Part A. It's not a calendar year deductible, which is your Part B. That $185 deductible for Part B medical, that's your calendar year deductible. Whereas your Part A is your benefit period. So that benefit period, for example, if you go to the hospital, you have a benefit period. That benefit period is going to continue until you've been released from the hospital or a skilled nursing facility for 60 days. And then if you were released and you went back in, you would have a new benefit period. You would have a new $1,364 deductible. You only have 90 days in a hospital. That's another reason you want to supplement. You do have a lifetime reserve of 60 days, but after your lifetime reserve and your 90 days, that's all original Medicare covers for your hospital, whereas the supplements are generally going to cover another year. I know in my situation, if I was in the hospital for 90 days, if I was on life support or what have you, God forbid, I know I wouldn't want the tubes pulled for me. I don't know about you, but that being said, if I was there for a year, please, I think that's enough. So that's why you want a supplement, to make sure that you extend your coverage for Part A hospital, if not an Advantage plan. You don't want to have just original Medicare. Skilled nursing facility, you can see, for example, 21 to 100 days, 170/50. This is, again, all original Medicare. So again, if you have a supplement or a Medicare Advantage plan, it's generally going to pick all these things up. Okay, benefit periods in original Medicare. Measures the use of inpatient hospital and skilled nursing facilities. We just talked about the benefit periods a minute ago on the slide before. Maybe I was a little premature because I was mentioning again that you can see it says ends when you're not in the hospital or skilled nursing facility 60 days. So I guess I got ahead of myself, because if you got out of the hospital for 60 days, again, you went in the hospital, unless you have a supplement, you're going to be responsible for another deductible. No limit of number of benefit periods you can have. So you can have as many as you want. It's unlimited. Okay, do I need to sign up for Part A? It's free for most people. Again, you can work for it. Most people qualify based on your work history or the work history of your spouse. Talk to your benefits administrator or call my office. Again, most of the time you definitely want Part A, even if you're going to be on the employer plan. Your Part A and Part B can have different effective dates. If you have an HSA, health savings account, you can't contribute to it. So that would be one reason, if you have an HSA, you don't want to enroll in Part A. But most of the time you're going to want to enroll in Part A. Part B, those are all the things we've talked about, all the medical services. But again, there's a premium for Part B, which is a standard premium right now is $135. And if you make more money, and I think one of the slides is going to get into this, depending on your income, there could be something called an IRMAA, an income-related modified adjustment amount. So that Part B premium can be more if you're a high-income earner. Oh, okay, there it is. Standard Part B premium, $135.50. They're talking about the IRMAA right there, depending on your income. And the IRMAA always goes back 2 years. So your 2020 IRMAA would be based on your 2018 adjusted gross income. Okay, so here's the exact numbers. This is for 2019. If you are an individual and you make $85,000 or less, or $170,000 joint return, that's most of the folks out there, you're going to pay the standard Part B premium of $135.50. Now, if you're lucky enough to be the highest income earner, which is the maximum is $500,000, individual $750 joint return, then your Part B premium will be $460.50 a month. But you can see that it adjusts, and there's different layers or different cutoff points between $135.50 and $460.50. Your Part D, based on your income, will also have an IRMAA. Most people, for their prescriptions, just pay the prescription drug premium, which is if you make, again, the first layer, $85,000 or less, or $170,000. But if you make a higher income, you will also have an IRMAA for your Part D drug plan. Original Medicare, again, your yearly deductible for Part B is $185. It might be slightly adjusted for 2020. And you've got your 20%, which your supplement or your Medigap policy will cover. Part B, inactive employment. If you don't have coverage through your employer, you're definitely going to want to not delay Part B and get it, because again, then you're going to have to enroll during your general enrollment period, January through March, for July 1st, and you're going to have a penalty. So probably not going to want to do that. If you have insurance through work, you will have a special enrollment period. Should I sign up for Part B? Most people pay a monthly premium. Again, if you're collecting Social Security, but right now, full retirement benefit for Social Security is 67. So if you're just turning 65, you're probably not going to have it come out of your Social Security. You're going to be getting a bill. But if you are collecting Social Security, you will have your Part B premium just automatically coming out of your Social Security. When must you have your Part B? If you want to buy a Medicare supplement policy or Medigap policy, or a Medicare Advantage plan, as we talked about, you guys need to have Part B as well as Part A. If you're eligible for TRICARE, you also, once you're no longer active duty, you're going to need to be in Part B. If you're on active duty, you don't have to be enrolled in Part B. If your employer requires you to have it, less than 20 employees. Talk to your employer unit benefit administrator. What isn't covered by Part A and B? Most dental care, eye exams, dentures, cosmetic. Again, a lot of these things are covered by some of the Medicare Advantage plans out there. Believe it or not, even massage therapy and acupuncture and hearing aids. Long-term care isn't covered on any of these plans. That would be a separate policy, something that we would be happy to help you with, something I'm a big believer in from personal experience. So if you want to get information on that, please, again, reach out to me. Be happy to help you on the long-term care insurance as well, or getting you a quote for that. What that does is pay for someone to either stay at your home, or whether you need to go to an assisted living home or nursing home, because the prices paying it for yourself are exorbitant. And if you could at least transfer some of that risk to the insurance company, it's something you're definitely going to want to do. Okay, let's check our knowledge here on question 2. Medicare Part A helps pay for all the following when medically necessary and requirements are met, except for A, diabetic testing supplies, B, an inpatient hospital stay, C, an inpatient skilled nursing facility stay, or D, hospice care. Gee, what is it? I think it's A, diabetic testing supplies. Let's try it. Yeah, because of the fact that that's a Part B. The inpatient hospital and hospice, that's all your Part A. That would be under Part B. Let's check our knowledge here. Question 3. For Medicare Part B, in most cases, you pay a monthly premium, a yearly deductible, 20% coinsurance for most covered services, or D, all of the above. I'm going with D, all of the above. Yeah, D, all of the above. Medicare supplement insurance policies, Medigap policies. They're sold by private insurance companies. They fill the gaps, deductibles, coinsurance. We talked about all that, okay? Here's some of the Medicare policies. Now remember, if you have Plan F, you can keep your Plan F. If you have, for 2020, you're not going to be able to get Plan F. You're not going to also be able to get Plan G, because Plan F and Plan G both pick up your Part B deductible. And Medicare saw that, based on the studies that they did, people use their health care more judiciously if they have a little skin in the game. That being said, especially if you already have a Medicare plan and you have a Plan F, there's something called a birthday rule. We could switch you from Plan F to Plan G, which is exactly the same plan, except you have the Part B deductible, and it's generally quite a bit less money. Very often, depending on your age, it could be $700 or more a year less to have an $885 deductible. So you're still well ahead of the game, more than $500. Call my office so we can go ahead and take a look at the pricing for Plan G versus Plan F and see if it makes sense for you to change. And again, during your birthday rule, which is your birthday month or the month before, we can make that move for you without any health questions. 2020 Medigap Changes. On or after January 20, 2020, there's no standardized Medigap policy may provide coverage for the Part B deductible. This is pretty much everything we've already covered. Do I need to buy a Medigap policy? Again, it only works with the original Medicare, other supplements, can you afford medical deductibles, etc. Okay, let's talk about some open enrollment periods. When is the best time to buy a Medigap policy? Last 6 months, minimum, maybe longer in your state. That's 6 months from when you turn 65, you can get a Medigap policy. You have protections, and during your Medigap OEP, the company cannot refuse to sell you a Medigap policy, and there's no pre-existing conditions. Like we discussed before, you can get a Medicare supplement anytime if you answer medical questions. You're not guaranteed issue, but they can also tack on pre-existing conditions down the road too if you don't have other coverage. How to buy a Medigap policy, decide which Medigap policy you want, compare your plans, call my office. I can talk to you about all the different companies, the Medigap policies. We can do a cost-benefit analysis. They're pretty much standardized, but some of the Medigap policies now actually offer some extra goodies too, beyond just the original standardized supplements. All Medigap policies help pay for prescription drug co-payments. True or false? It's false, right? That's what Part D drug plans do, right? Only Medicare covers a couple drugs like chemo drugs, anti-nausea, stuff like that. But that's what the Medicare Modernization and Prescription Drug Act was all about, Part D drug plans. Part D is an optional benefit available to people with Medicare. It's run by private companies, so it's great that the private companies and the government work together. The premiums are pretty inexpensive. If the only thing you paid for your Part D drug plan was a premium, the companies would lose a lot of money. They also get money from the government. You really want to take advantage of your Part D drug plan. I think one of these slides will talk about it later. If you enroll later, you're going to have what's called a LEAP, a late enrollment penalty, for the rest of your life. So even we can get you a very inexpensive Part D drug plan if you don't take a lot of prescriptions. I highly recommend that that's not something that you go without. This is for 2019. Costs vary by plan, same as 2020. A monthly premium, yearly deductibles. Some plans waive them, some plans don't. The three phases are going to be your deductible if it applies, then you're going to have what's called your initial coverage phase. Then you're going to get into the coverage gap, which is also known as the donor hole, and then into your catastrophic coverage, which is going to be the least out of pocket. But most people are never going to get into that. There's some changes for 2020. We're going to talk about that in just a minute. So we're basically, as far as your out of pocket's concerned, the donor hole and the initial coverage level are going to be the same, because the donut hole throughout the years has been narrowing, and this is going to be the first year basically where they're the same as far as your out-of-pocket costs are concerned. This is 2020, because we just talked about 2019. Here's 2020. The deductible's a little different. It's $435. Now again, some of the Part D drug plans waive the deductible. Most important thing is that we check your prescriptions. We run a custom report to make sure that your prescriptions are covered, because if they're not part of the formulary, unless you get an exception, there's a good chance that they will not be covered. Most likely they will not be covered if they're not part of the formulary, so we need to get you guys the right match. Again, your prescriptions change, formularies change. Let's make sure you have the best coverage for your specifics. When you get into the ICL, the initial coverage level, 25% of prescription drug costs that's your standard deductible, and the donut hole, which is the $4,020. Now we're into the coverage gap, which is known as your donut hole. And what this is saying is basically it's the same thing as the initial coverage level, where you're going to be paying 25% of the costs of the generic and the brand name, which is the same as your initial coverage level. Even last year it was more. Everyone said, oh boy, I'm in the donut hole. Well, good thing is that donut hole with that law has been shrinking and shrinking. Once you meet your out-of-pocket costs, including the 70% drug manufacturer discounts, that's a discount I was just talking about. So the total number to get into your catastrophic is $6,350, but that's not $6,350 out of your pocket, thank God. That number comes from what you pay, what the insurance company pays, and the 70% drug manufacturer discount. So when all those three pieces together comprise the troop of $6,350, now you're into your catastrophic coverage. And the good thing is, once you reach that catastrophic coverage, then you're just going to pay $3.60 for generic, $8.95 for brand name, or 5%, whichever is greater. Okay? So for those of us that have more chronic conditions or take some really expensive drugs, then you're going to get into that catastrophic coverage. Most of those people, most of you guys, will not have to get into that catastrophic. You're just going to remain in either your initial coverage level, or maybe you'll get a little bit into your donut hole or coverage gap. Here's the standard benefit for 2020. Catastrophic, we just talked about it, 5%, $8.95 brand, $3.60 generic, the greater of. Both the coverage gap and the initial coverage, we talked about that, is 25%. The deductible is $435. Remember we talked about the IRMAA earlier for Part D? That I told you guys, if you have a high income, you're going to pay not only an IRMAA for your Part B, you're also going to pay an IRMAA for your Part D. If you, for example, if you make over $500,000 individual or $750 joint return, then you're going to be paying a $77.40 income-related modified adjustment amount in addition to the premium for your Part D drug. It's optional. You do not have to enroll in it. But again, I highly recommend that you do. If you have a limited income, there's something called extra help. I can tell you guys how to do that. If that's not something you're automatically enrolled, I can give you the information on that as well. If you're on Medi-Cal, that will automatically happen, but there's other ways to get extra help too. Who can join Part D? You must have Medicare Part A and or Part B to join a Medicare prescription drug plan. So and or. Unlike a supplement or advantage plan, you don't have to have A and B. You have to have Medicare Part A and or Part B. So you don't have to have both. You must live in the planned service area. You can't be incarcerated. You can't live outside of the U.S. You must join a plan to get drug coverage in most cases. Remember we talked about the LEAP before? We call it a late enrollment penalty, a LEAP. If you don't get the Part D during your initial coverage period, then you will be penalized if you don't have credible coverage when you leave your work plan. So if you don't have Part D drug plan, you will be penalized unless you qualify for extra help. This just goes into details how that penalty works. And by the way, that penalty is for the rest of your life. It's 1% of the full months eligible without credible coverage. So the base premium right now for 2019 was $33.19, so you're going to pay 1%. That's going to be over $3 a year for each year that you don't have it. And again, that's for the rest of your life. Okay, Part D, cost considerations. D, drugs, right guys? Again, your formularies. Tier 1 is your preferred generic, Tier 2 is your regular generic, Tier 3 is your preferred brand, Tier 4 is your regular brand, and Tier 5 is your specialty. Your lowest tier, Tier 1, is going to be the least amount of money. But if you take a prescription that's not on the formulary, it's not going to be part of any tiers. It's not going to go toward any of those phases of reaching your maximum out of pocket, getting into your troop like we discussed. So it's critical that you get prescriptions that are part of your formulary and we run a report. Again, it's possible that we could get an exception. As your broker, for example, if you needed a prescription, I'm there as your advocate. When insurance companies come up with a formulary, they have to have drugs in every single therapeutic asset class. So maybe you might want one drug and you might have to take another drug. And if that doesn't work, then maybe we can get you an exception. And that's the kinds of things we do at my agency. But if possible, we want to make sure the prescriptions you take are already on the plan's formulary. Every plan has a unique formulary. Let us run a report. When can I enroll in a Part D drug plan? During your 7-month initial enrollment period, your IEP, you guys should know these acronyms by now. During the yearly enrollment period, OEP, or annual election period, October 15th through December 7th. And again, your coverage begins January 1st. If you get Part B for the first time during your general enrollment period, remember that would be mostly if you guys are late enrollees. You have to wait until the general enrollment, January to March, for July 1st. Most likely you're going to have that 10% penalty per year at that point, right? You might be able to enroll at other times. Remember, now started last year, we had the open enrollment period. If you have a Medicare Advantage plan, you can switch to another Medicare Advantage plan, and special enrollment period, moving out of the plan service areas, all that good stuff. If you get extra help, you have some special rights. And again, we had the 5-star SEP. Compare plans by the computer or phone. Medicare has a great plan finder. Again, call my office. Let us ask you some questions and we could drill it down. We know all these plans. We represent almost every major carrier. It doesn't cost you an extra penny to use our services as we get paid from the insurance company. Here's some things I should consider. Do you have credible drug coverage, which is coverage as good as Medicare? That would be, for example, an employer plan. So if you have an employer plan with credible drug coverage, you don't have to enroll in Part D and you won't be considered a late enrollee or have that leap. But it needs to be credible drug coverage, which means that your employer's prescription plan is just as good as the plan that you would get under Medicare Part D. Will the coverage end when you retire? How much do you pay for your current drug costs? What do your premiums cost for Part D? You might be on your employer plan, and if it doesn't cover your prescriptions right, you still might want to enroll in a Part D drug plan. Medicare prescription drug coverage is also known or called Part A, guys, Part B, Part C, Part D, or all the above. D, drugs, right? Number C, right. Okay. Way to go, guys. It's July. You enrolled in Medicare last year but didn't enroll in a Medicare drug plan. Generally, when is your next chance to enroll in Part D? Open enrollment period. Initial enrollment period, your next birthday are 12 months after your IEP. That's your initial enrollment period. What's the answer? Open enrollment period, which is right now, October 15th through December 7th. So we want to get that because every year, again, not only you don't have your prescriptions that you might need, your leap is going to get bigger, your late enrollment penalty. So that's just going to keep piling on. So you don't want to wait. Okay, Medicare Advantage plans, Part C. We've talked about these. Most of them, again, are HMOs, but there are some PPO Medicare Advantage plans. A lot of people think if they have a supplement, it's a PPO, but it's not a PPO. It's original Medicare. It means you can go to any doctor that you want unless you want to call the provider network Medicare, and the supplement picks up the gaps. That's different than a PPO Medicare Advantage plan. And a Medicare Advantage plan, you still have Medicare with all the rights and protections. Again, you get all the plans that are covered in Part A and Part B. So you're not going without anything. Different out-of-pocket costs, different MOOPs, maximum out-of-pocket based on the Advantage plan. So that's why you want to compare and call our office. May choose a plan with extra benefits. Have a yearly limit on your out-of-pocket costs. We've gone over all that, guys. How Medicare Advantage plans work? Again, you need to be in your service area. And Medicare pays a fixed amount for your coverage each month to the companies offering a Medicare Advantage plan. What does that mean? You might be thinking, how can I get a zero premium Medicare Advantage plan? It almost sounds too good to be true. If you have original Medicare, the government figures that the average senior health care costs maybe $700 or $800 a month, somewhere in that neighborhood. And that's what they know that they're going to pay for Medicare. Again, they're going to cover about 80% of the costs. But with the Medicare Advantage plan, they're taking that money and they're paying the insurance company. So the insurance company gets paid from the government. They work together. And what the insurance company is able to do with the same amount of money is not give you the 20%, not give you the deductibles, or at least for Part A, not give you the cost sharing, plus give you prescriptions. So they're able to give you more coverage with less exposure for the same price that the government can do it. The biggest reason they can do that is because they're able to control their costs more, because generally they're HMOs, which means that the medical groups are capitated without getting too technical. So that means they take a large portion of that money that they get and they just pay the medical groups. Their costs are fixed and their exposure is fixed, and everyone is able to win. So that's the economics of it. Sorry if I'm going into too big of detail, but a lot of people like to know how that works. Okay, now you guys are all experts. When can I enroll in Medicare Advantage plan? Again, coming up now. Call my office, October 15th through December 7th. We can help you with all those things. Again, you must have Part A and Part B to join. Most offer comprehensive coverage. Some plans require you to use a network. That's generally going to be a Medicare Advantage plan where you have a primary care doctor and you're going to need a referral to see a specialist. A lot of people don't know, even if their specialist is part of the Medicare Advantage plan, they might not be able to go to the specialist unless he or she is part of the same medical group as their primary care doctor, because when you join a Medicare Advantage plan, you pick a primary care doctor. A lot of times primary care doctors are part of more than one medical group. So if you have specialists, you're going to want to make sure we choose the primary care doctor that's in the same medical group as your specialist, so you don't have any surprises. Again, those are the kinds of things that we do in my office as well. That's why you want to call us, so you don't have any surprises when you need care. How are Medicare gap policies different than Medigap, than MA policies? Again, Medicare Supplement, private companies, Medicare Advantage, government state, Medicare Advantage federal, must be approved by Medicare. Supplement fills the gaps. Medicare Advantage plans become primary, right? You must have Part A and B, both of them. You need a premium for supplement. It says most cases you need a premium for Advantage plans. In Southern California, there's a lot of counties that don't have premiums. In Northern California, the premiums, depending where you live, can be very low, and depending on your county, could be nothing as well. Are you still with me? Medicare Advantage plans help you pay for gaps in original Medicare. You know that's not the case. That's what a Medicare and Medicare Supplement does, right? Must keep the same providers all year. No, because even if you have a Medicare Advantage plan, the great thing is you can change your provider as long as they're part of the network. As long as you call by the 15th of the month, you can change your primary care doctor for the first of the month. Are private plans approved by each state? I don't know. Must cover all Medicare Part A and Part B covered services. Yes. Yes. D. Okay. Generally, if you have end-stage renal disease, you can't enroll in Medicare Advantage plan. That's, believe it or not, true. You're going to want to be in a supplement unless you have a certain kind of Medicare Advantage plan that's specifically designed for people with ESRD. It's against the law for someone who knows that you have Medicare to sell you a marketplace plan. That would be like, for example, Covered California. We are a certified insurance agent for Covered California, but generally that's for people who don't have Medicare. You're only going to qualify for premium assistance if you do not qualify for Free Part A. If you qualify for Free Part A, you don't want to stay on your marketplace plan, because you might be thinking, I want to, I'm comfortable with it, I'm getting all this premium assistance, but it's not clear to you guys until you file your taxes and you get all that money that you got in premium assistance. You're going to have to pay it back, thousands of dollars, if you qualify for Free Part A. You do not want to keep your marketplace plan. Let me be real clear. You don't want any big surprises, multi-$1,000 surprises. If you don't qualify for Free Part A, you can get premium assistance, but that's not too many people. You may qualify for Medicare based on a disability. We talked about all that. Okay. We talked about that. If you're entitled to Social Security disability insurance, you may qualify for Medicare. True or false? You know that's true. Medicare savings programs help from your state paying Medicare costs, including Medicare premiums, deductibles, and coinsurance. Extra Help, Medicaid, those are MSAs. That's a kind of a unique plan. Might be available. A lot of times most counties don't have MSA plans available, but it's some do, and it could make sense. Again, call my office. I'll let you know if it's available in your county and the pros and the cons. Extra Help will help lower your copays. There's different levels of Extra Help for your Part D drug plan. You automatically are going to qualify for Extra Help if you get full, we call Medicaid in the rest of the country. In California, it's Medi-Cal, because us Californians, we have to have everything with our own name for Cali, right? Medi-Cal. Everywhere else in the country, it's Medicaid, but we can't be like the rest of the country here in California. Supplemental insurance, SSI, help from Medicaid paying for your Medicare premiums. All others must apply, and again, we can help you with that. What is Medicaid? It's a joint federal and state program, helps pay for your costs. Some people qualify Medicare and Medicaid. By the way, if you qualify for Medi-Cal and Medicare, there's some great Medicare Advantage plans available for dual eligibles that give you guys, for example, unlimited dental insurance, because Dentacare through Medi-Cal has a limited benefit, can give you all kinds of amazing extra benefits if you guys are full eligible dual for some. So there's some special plans specifically targeted toward folks that are dual eligible. So if you call my office, we can go over those plans as well. How is Medicare and Medicaid different? Medicaid is eligible based on income. Medicare is available to you, again, pre-65 based on specific conditions, working 65 or older, etc. We've covered these things. What is Children's Health Insurance Program, CHIP? Healthcare coverage for uninsured children and families, jointly funded by federal and state. Okay? Medicare is a health insurance program. It doesn't cover all your health care costs. Again, that's what supplements, advantage plans, all that's good for. I'm not going to bore you guys with the acronyms. I'll send you the chart. If you chat me, I'll send you the chart and you can have it. But I think we're done. If you braved the storm, I want to thank you, because I know that was a lot of information. But the most important takeaway is call me. Make sure you got the best coverage. Things change. Prescriptions change, plans change. Again, you can have plans that pay for part of your Part B premiums. If you have a supplement, we can move you, for example, from Plan F to Plan G, stick $500-$600 in your pocket. Just because you had a plan that worked for you a few years ago doesn't mean it's the right plan today. Let's at least give you the peace of mind to knowing, if you don't want to make a change, that you've got the right plan. That's what I'm here for. I've been in this business for 30 years. No cost using my service. I've got a great team here to back me up. If you work with me, we're here not only during the process to make sure you get the right plan for today. You call me whenever there's a servicing need. We run your prescriptions every year. Make sure you continually have the right plan. I have clients that have been with me since they turned 65 that are 95. I've had clients for 30 years, and I hope to be able to do the same for you. I wish you guys the best, and thank you for listening.